So you have to look into the only challenges of leadership in the health and social care sector. There are several challenges facing leaders in the health and social sector. Then we have to look at the complexity. The sector deals with human health and well-being, which are multifaceted. Leaders must balance competing priorities across prevention, acute care, and chronic diseases. You have to also look into regulations. Healthcare is highly regulated sector. Leaders must ensure compliance with myriad laws and policies related to quality, safety, data privacy, and fair practices. This creates administrative burdens. Then we have ethics. Leaders must make ethically complex decisions daily, including resource allocations, end-of-life care, equitable access, and duty of care. There are many competing ethical frameworks to navigate. Then we have to look into the cost pressures. Healthcare costs are rising faster than inflation. Leaders must find ways to control costs while not compromising on quality of care provided. This becomes difficult to trace off. And look at innovations. You have to recognize the need to innovate to improve access, quality, and patient experiences. And we can also look to talent shortages. Healthcare suffers from shortages of highly skilled professionals. Leaders must focus on recruitment, retention, and managing with constrained human resources. And then we also have public trust. Maintaining public trust in the face of emerging technologies, data security threats, funding challenges, and scandals is a key leadership imperative. And lastly, stakeholder management. Key stakeholders like government, insurance, and regulatory bodies have competing interests. Managing these diverse stakeholders is tricky yet vital. In summary, healthcare leadership demands a complex balancing act spanning scale, ethics, cost control, change management, and building robust partnership. It is a demanding yet vitally important domain. Let's look at the medical leadership. Medical leadership. Okay. So you can watch this lecture and then let's implement. Let's proceed on to the different leadership styles that can influence the outcomes of various ways. We have to look into the autocratic leadership that involves people imposing themselves and taking unilateral decision without consulting other members of staff. Then we have the democratic leadership that involves team members being involved in decision making. Then we have transactional leaders set rewards and consequences. Then we have the laissez-faire leadership delegates extensively useful for empowerment but can lead to lack of direction. Then the transactional leaders that set rewards and consequences. This improves efficiency but not necessarily innovation. Outcomes are aligned to specific goals. Then the last bit is the transformational leadership that inspire change through vision and relationships. Outcomes can be widespread innovation, but team members may also burn out, and it inspires change through vision and relationship. Outcomes can be widespread innovation, but team members may also burn out because it requires vision and relationship. Outcomes can be widespread. The servant leaders prioritize team growth. Servant leaders, the outcomes tend to be more equitable and focus on well-being over short-term goals. The pace may be slower. The ethical leaders, model integrity. Outcomes focus on sustainability, accountability, and stakeholder benefit over personal gain. By the decision-making process slows. The visionary leaders articulate ideal future states. Outcomes include high-risk innovation and radical transformation, but also potential chaos. The best leaders adapt to style to the situation, and team needs to optimize outcomes. They combine elements of various styles, focusing on the team while also providing developmental opportunities. Very key. Let's look at a typical video of transformational leaders. Okay.